The Newsday continues here on One News Now. I'm Riza Diaz. The OCTA Research Group is calling for a stricter implementation of the NCR Plus bubble to prevent the further spread of the COVID-19 Delta variant. In a radio interview, OCTA fellow Guido David stressed that the country should take a proactive response in addressing the new threat. David noted that their proposed bubble would be meant to keep away the Delta variant from the capital region as much as possible. This came after the Health Department reported 16 new Delta variant cases, 2 of which have indicated home addresses in Metro Manila. National Police Chief Guillermo Eleazar orders the deployment of more personnel in public areas to prevent mass gatherings. Eleazar issued the order after Interior Secretary Eduardo Año said he will require the PNP and other law enforcers to strengthen their visibility in public places. This is to ensure that health protocols are observed and mass gatherings are prevented. Police commanders on the ground have been tasked to determine how many more men are needed to secure public locations in their areas of responsibility. A vaccine expert says systematic data on vaccine effectiveness and real-world evidence are needed to overcome the pandemic. This as Southeast Asia reels from the Delta variant. Let's listen in.
Data needs change over time. So in the beginning, we needed to know whether the vaccines worked. And we have ample evidence that all of the currently WHO-approved vaccines are safe and efficacious. Now what we need is data on real-world evidence. How do these vaccines now work when we roll them out in millions and millions of people? And unfortunately, we have pretty good data on Pfizer. We have reasonable data on Moderna. We have a lot of data on AstraZeneca that actually the 2 doses of the AstraZeneca vaccine really have effectiveness in preventing severe disease, hospitalization, and death that's in the 80% range or above 80%. So really, really good data. The Chinese vaccines, Sinopharm and Sinovac, again, when you look at effectiveness, does the vaccine prevent severe infection, hospitalization, and death? We're seeing reports of, sometimes over 90%. So again, we have to make sure that when we hear about reports of infections in people who've been vaccinated, that we really stop and say, now, are these reports or is this a systematically collected data that is giving us the kind of information that governments need in order to change policy?
And I guess in some cases, social media may not even help because you do get a lot of this information unfiltered in some cases, of course, coming through. So we have enough data as far as, I guess, the efficacy is concerned. The other big issue seems to be still supply and the bottlenecks. And people seem to think that when you talk about supply constraints, it's just in creating the vaccine itself. It's putting the vaccine into vials, it's delivering that. Where do you see the bottlenecks still at this point in time?
So, and just to make the point, as you did in the beginning, we've given 3.5 billion doses of these vaccines in, 9 months. That's remarkable. I mean, flu vaccine, which is used globally around the world every year, 400 to 500 million doses maximum. So we've given 3.5 billion doses, and that's put a lot of stress. So the companies are trying to make new deals to get other contract manufacturers of high quality. We're trying to secure additional supplies of things like vials and stoppers in order to bottle the vaccines. But there are going to be delays as new vaccines are brought online, as you scale up from low rate initial production to your standard rate of production that and that process takes months. At the same time, there are some other things that are potentially concerning. Those Chinese vaccines were approved in the end of last year, beginning of this year. It took until May for the WHO to go through very carefully all the data that was found for those vaccines that they had for those vaccines, and it was approved at the end of May. Now it's taken 6.5 weeks to get the contracts in place to get those vaccines into COVAX, and so it's not that people aren't hurrying, but there are processes, and we're doing this for the first time. So the more efficient we can be at getting rid of all these little things that we really could anticipate, the more important, or the more quickly we'll be able to get the vaccine out. But then the final part here is And just take the United States as an example. The birth cohort, the number of births per year in the United States is usually around 4 million. And that's the group that normally gets vaccinated, right? I mean, most children get all the childhood vaccines, and that's the biggest group of people who are vaccinated. The United States population is about 330 million. So imagine going from 4 million to 330 million. It was hard in the United States. But can you imagine when we start doing this in low and middle income countries?
Jerome?
When we stop, yes, sorry.
I just want to move things on a little bit, because why is the international community not getting together and coming up with some sort of vaccine passport? I mean, why aren't people who are vaccinated not allowed to travel freely, I suppose? Is it a case of the fact that you can actually carry the vaccine still, even though you have been inoculated, or is it that they just don't trust these vaccines?
I think it's in part that in order to have vaccine passports, you have to have agreement between countries that they will cross-recognize the different vaccines, and that's not always the case. For instance, in Korea, you have to be vaccinated with a vaccine that the Korean government has approved. So will they take Sinopharm or Sinovac vaccine as proof? So there are a lot of individual issues that keep countries from setting up the kinds of systems that are necessary in order to cross-recognize each other's vaccination certificates. So, for instance, if you want to go from the United States to Korea, you actually have to send in your vaccination certificates to a Korean consulate. It has to be reviewed, and then potentially an exemption is granted. So this is a individual process, and until we can standardize it, move it along quickly, it's going to be a rather difficult thing to accomplish.
Meanwhile, Los Angeles County in the United States is once again requiring the wearing of face masks. This is due to the threat of the Delta variant. But what is the likelihood of getting infected for people who have been vaccinated? More details on this Bloomberg report.
The Delta variant is really a scary variant in terms of how quickly it's moving in the population. Again, if you're vaccinated, you're protected, but you never want to rely on just one thing, particularly if you know that there's going to be a high number of cases around.
Andy, you can understand the confusion around here. We're being told the vaccines are incredibly effective. They're even effective against the variant. And then you have health professionals, including yourself, saying it is a scary variant. You should be more careful even if you're vaccinated. What is the potential consequence for vaccinated individuals if they do come into contact with the Delta variant?
The outlook is really good. So even if you're vaccinated, you have a much less likelihood of getting infected, much lower likelihood of even symptomatic disease, and an incredibly low likelihood of getting severe disease, meaning hospitalization or death. So the vaccines are working. The data seems to indicate they're working well against the Delta variant. So you're in a good situation. I think the data that's going to be coming out soon is going to be essentially pretty clear. When vaccinated people get infected, they pick up the infection from unvaccinated people. So more and more, we're seeing that the unvaccinated population is posing a general risk to the population with respect to whether or not you're vaccinated or not. So this really comes down to, I think, a better method of communicating the safety and the efficacy of the vaccine so we can get that vaccination rate up. That's going to solve a lot of our problems.
So, Andy, if you were advising the Biden administration right now, President Biden yesterday said he's waiting to hear from his people basically about reopening travel with Europe and that we should have an answer in the coming days. Would you tell him not to do that given the concerns around the Delta variant?
I think travel is the lower end of the concern here. We've got the Delta variant here. We need to think about ways that we can limit the spread of this virus here in the U.S. One of the things that I think might be important for us in terms of gaining more trust in the vaccines is to get full FDA approval for the mRNA vaccines and the J&J vaccine here in the U.S. I think there are a lot of people that are waiting for that final stamp of approval before they jump in and get the vaccine. We need to move that forward faster to really reassure people that the data that we're seeing here about safety and efficacy is really overwhelming, and there's no reason for us to keep using these emergency use authorizations. We should just flat out approve these vaccines.
Now, here are other stories we're keeping our eyes on. The death toll in devastating floods in Western Germany and Belgium has risen to at least 170. This is after burst rivers and flash floods destroyed houses and ripped up roads and power lines. Officials consider this as Germany's worst natural disaster in more than half a century. Hundreds of people are still missing or unreachable as several areas remain inaccessible due to high water levels. Brazilian President Jair Bolsonaro said he feels fine and cannot wait to get back to work. According to the hospital, Bolsonaro is making satisfactory progress and may be discharged within the next few days. He's been confined since Wednesday for treatment relating to an obstructed intestine following a near-fatal stabbing in 2018. And Titane, an outlandish film, has won the top award at the 2021 Cannes Film Festival. Director Julie Ducournau is only the second woman to receive the Palme d'Or and the first female to win it alone. The award was prematurely revealed by U.S. director Spike Lee at the opening ceremony. Despite this, Ducournau was still emotional when her film was officially announced as the winner, saying the evening was or has been perfect because it's been imperfect. And for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.